The silent strength. The air was thick with smoke, the acrid smell of gunpowder and sweat mingling in the heavy mist that hung over the battlefield. The sounds of artillery fire echoed in the distance, punctuated by the cries of the wounded and the constant hum of helicopters bringing in more casualties. In the midst of it all, a small but determined group of women moved with purpose through the chaos. The nurses of the Queen Alexandra's Royal Army Nursing Corps, QARANC. Clara Bishop, a young nurse with quick hands and a calm presence, bent over the makeshift medical station set up behind a crumbling stone wall. Her face was streaked with dirt and blood, but her eyes remained focused, her hands steady as she worked. A soldier, barely more than a boy, lay on the table in front of her, his chest rising and falling shallowly. The wound on his leg was severe, but it wasn't fatal. At least, not yet. "Keep pressure on it, Lieutenant," Clara instructed, her voice clear above the noise. "We need to stop the bleeding." The young officer beside her, his face pale and strained, nodded and pressed a bandage down firmly. Clara worked quickly, her fingers moving with a practiced rhythm as she cleaned the wound, her mind a machine as she mentally ran through the steps of triage, prioritizing those most in need. "Keep breathing, soldier," she whispered, though she knew he couldn't hear her over the sounds of war. "Help's on the way." She had joined the QARANC just a few years earlier, eager to serve her country and make a difference in the face of the horrors she knew were unfolding on the front lines. She had been trained for moments like this, for the endless hours of standing in the shadow of death, stitching up wounds and offering comfort where there was none to be found. But nothing had prepared her for the sheer scale of it, the constant tide of pain and fear that never ceased to roll in. The war had a way of stripping people down to their most raw selves. Clara had already seen so much death, too much. Faces she had treated in the field yesterday were now silent, their bodies lined up with the others in the cold room that had been converted into a makeshift morgue. Yet, through it all, Clara had held on to one unwavering truth. She had a job to do. She would save who she could. A stretcher arrived next, two soldiers struggling to keep it steady as they brought in a woman, another nurse, though Clara had never seen her before. Her uniform was soaked through with blood, but her face remained calm, a mask of determination. "Field hospital's been hit," the soldier carrying the stretcher explained, his voice tight with tension. "She was helping the wounded when the mortar hit. Took most of the blast." Clara moved quickly, signaling for them to lay the stretcher down. She knelt beside the nurse, her heart pounding in her chest as she assessed the damage. The woman's body was covered in burns, her limbs mangled by shrapnel. Clara swallowed hard, knowing that the chances of saving her were slim, but she wouldn't give up, not without a fight. "We're going to take care of you," Clara said softly, though she knew it was more for her own sake than for the other nurses. She began cutting away the ruined uniform the extent of the injuries. She could see the other nurses gathering around her, hands already at work, but Clara's focus remained singular, on saving this woman's life, no matter the cost. The other nurses worked swiftly and methodically, setting up an IV drip and administering oxygen as Clara continued to assess the damage. One of the nurses gently placed a cold compress on the woman's forehead, while another worked to stabilize her blood pressure. Clara's mind raced through the steps, knowing that even as they did everything right, the odds were slim. But they couldn't stop. They couldn't allow themselves to stop trying. After a long hour of intense work, the woman's condition stabilized, but Clara could tell she was hanging on by a thread. The soldier who had carried her in still lingered nearby, his eyes fixed on Clara. "Is she—" he began, but his voice trailed off, unsure if he should ask the question aloud. Clara met his gaze and shook her head. "She's not out of the woods yet, but we'll keep her alive as long as we can. That's all we can do." The soldier nodded, his face etched with both relief and the hard truth of the situation. He turned to leave but hesitated, glancing at Clara once more. You're doing good work, Miss Bishop," he said, his voice thick with gratitude. Clara watched him walk away, her breath catching in her throat. It wasn't often she received such acknowledgement. The nurses of the QARANC were always working in the shadows, never recognized as soldiers, yet no less essential. They were the silent strength holding the front line together. As the hours passed, the sounds of the battlefield seemed to fade into a dull roar. The work was unrelenting: shrapnel wounds, burns, broken bones. But Clara barely noticed. The nurses of the QARANC were used to this. They had learned to work amidst the blood and the terror, to fight their own fear and keep moving forward. The sun began to set, casting an orange glow over the battlefield. Clara wiped the sweat from her brow and took a deep breath, glancing around at the makeshift hospital that had been set up in the shadow of a crumbling building. It was a scene of organized chaos. Dozens of patients, the vast majority of them soldiers, were lined up along the walls, waiting for their turn to be treated. Some of them were conscious, others barely clinging to life. The nurses worked in pairs, moving quickly from patient to patient, patching up wounds and administering painkillers as best as they could. Clara knew there were soldiers out there who would never make it, their wounds too severe to survive. But she had to believe that they were doing everything they could. Every life saved was a victory, no matter how small it seemed in the grand scheme of the war. A soldier approached Clara, his face bloodied and pale, his eyes wide with panic. "Ma'am, we've got more coming in," he said, his voice frantic. "The lines are breaking. We need more hands." Clara looked around at the other nurses, each of them looking equally exhausted but still standing strong. They were always ready. They had to be. "Let's get moving," Clara said, standing and adjusting her uniform, now soaked with sweat and blood. She didn't flinch at the sight of it. It was part of the job. "Get those stretchers to the table. You there." She pointed to a soldier near the door. "Go check the triage area. We need more supplies, and keep an eye on those morphine stocks." She moved toward the stretcher with the new casualty, a soldier who had been caught in a blast. As the nurses worked together, there was a brief moment of silence between them, a shared understanding of the weight they all carried. They were not soldiers, not in the traditional sense, but in their own way, they were warriors. Not with weapons in their hands, but with bandages and antiseptic, with the quiet resilience that came from knowing what it took to keep people alive amidst the madness. The battlefield outside raged on, but within the makeshift hospital, Clara and the other nurses worked in synchrony, their hands steady even as their hearts broke. They had learned long ago that survival wasn't just about enduring. It was about saving lives wherever they could, even when the world around them seemed to be falling apart. The battle raged for hours, then days, with no end in sight. The days bled into one another, and Clara had long since lost count of how many soldiers had passed through her care. Some survived, others did not. There was no rhyme or reason to who lived or died. It was just the cruel randomness of war. In the quiet moments between the chaos, Clara would find herself walking through the rows of wounded, her hands moving mechanically as she offered what comfort she could. She'd find moments to pause beside the beds of soldiers who were too young, too full of life to have suffered so much. Their stories would seep into her bones, carrying a weight that never seemed to lessen. One afternoon, as the sun set and cast long shadows over the ward, Clara found herself standing at the edge of the tent, her hands gripping the edges of the flap. She watched as the soldiers, some of them bandaged and bruised, others still fighting for every breath, interacted with the nurses. She watched how they leaned on the women in uniform, finding solace in their steady hands and quiet voices. Clara knew the war wasn't over. She knew that for each victory there would be more losses. But she also knew that the QARANC was part of something much larger than just the battlefield. They were the silent strength, the backbone that allowed the war to continue, the hope that refused to extinguish. And as the last light of day disappeared beyond the horizon, Clara knew she would carry on, just as the others would. Not because it was easy, but because it was their duty. To heal, to stand tall, to be the silent strength when the world screamed in chaos. And so, Clara Bishop and the nurses of the Queen Alexandra's Royal Army Nursing Corps would continue their work, one life at a time, no matter the cost.